call lupus. It is one of those strange diseases that is frequently misdiagnosed because it imitates so many others. Lupus affects every person differently. With education, information, and research, something can be done. Let me introduce my guest to you, Mary Lemairs. Mary is a lupus patient. Thank you for coming, Mary.
Thank you.
Dr. M.S. Falk, who is a dermatologist. Dr. Falk, thank you for coming. Dr. Falk, why don't we start out by having you explain to us what lupus is?
Yes, it's rather difficult in a short period of time to explain just what lupus is, because it is probably not a single disease, but a number of diseases which are closely related. Now, in my discussion, I may use some terminology or words which are not familiar to you, and I don't mind your interrupting me and asking me to define them. But lupus is a condition in which the immune system, the body defense system, has gone haywire. It has been altered for one or more reasons, and as a result, it, instead of protecting us as it was originally meant to do against diseases such as germs and other foreign substances, it reacts against our own tissues, causing damage to those tissues and the symptoms of lupus. Lupus can actually affect almost every organ of the body, if not every organ. The skin, the kidneys, the heart, the lungs, etc. And the most frequent initial symptoms are joint pains or a skin rash. From then on, the patient may develop other symptoms, at times clear, these symptoms subside and then recur. It is a variable disease in its manifestations, in its severity, and it is a controllable but not a curable disease.
Dr. Falk, so many people say all of a sudden we're hearing about lupus. Is this a new disease?
Lupus is probably not a new disease, and it may have been described by Hippocrates in ancient Greece. But the term lupus was coined by a French dermatologist working in Paris at the Hôpital Saint-Louis in the mid-1850s, when he described a patient who had typical skin lesions of lupus. He did not recognize that it was a systemic disease, but he did describe the skin lesions very, very well.
I thought that the word lupus in Latin meant wolf.
Yes. The term lupus erythematosus was, again, as I said, coined by Dr. Alphonse Cazenave, the French dermatologist. Wolf is bad, and lupus is the Latin for wolf, and erythematosus means red, so he termed it the red wolf.
The red wolf.
Yes.
Dr. Falk, is it contagious?
Lupus is not contagious. There's no evidence at all that it's contagious.
Is it hereditary?
In the broad sense of the term, there is some evidence that there is a genetic or a hereditary predisposition to develop lupus. Lupus is not inherited in the way that blue eyes or brown hair or other features are inherited, but the tendency to develop lupus is more common in individuals in certain families than in others. There are precipitating factors which cause the disease to appear, and these are multiple, some of which are understood and some of which are not. My best example to illustrate that is that in identical twins, at least half of them, one of which has lupus, at least half of the other twin has lupus, and in many of the others there are laboratory manifestations of lupus, but the disease has not expressed itself clinically. In other words, the person has not shown signs of illness, but shows laboratory evidence of the disease.
Mary, when did you first learn that you had lupus?
I was first diagnosed as having lupus about 7, 8 years ago, but was sick prior to that and treated for rheumatoid arthritis.
Was it difficult for the doctors to diagnose your illness?
I guess it was difficult. They never diagnosed it, more or less. They treated me for rheumatoid arthritis, and then through the course of going to many, many doctors, I finally ended up with Dr. Falk. And that was a course of a couple years.
What were your symptoms?
The arthritis, the joint pains, the swelling of your joints and your hands, and muscle pain, fever, felt like you have the flu all the time, and basically just a lot of pain, and you're all tired, fatigue.
Dr. Falk, Mary mentioned arthritis. Now that's going to be confusing to a lot of people. Is arthritis part of lupus?
Rheumatoid arthritis, the inflammatory type of arthritis, and by the way, there are many forms of arthritis, is a close relative of lupus. It's among the, that's when I started to tell you that lupus was, or is a group of many different diseases. Rheumatoid arthritis is closely related to lupus, and patients with lupus often, very frequently, have joint pains as one of their symptoms, and very frequently the first symptoms. Sometimes the patient, it's transient, it varies from day to day. The patient says, oh, I've got a little rheumatism, and until it becomes a little more severe or they develop additional symptoms, they don't even consult a physician. They take aspirin and they do get relief from it.
So it could develop into something far more serious.
Yes, yes.
Now, Mary, how has this affected your life and your career?
It's hard to say how it has affected my life or my career. The difficulty that I had was accepting the fact that I had the disease and accepting the fact that there were times when I had to slow down, which to this date I still have a hard time accepting. Basically, for a 2-year period, I felt like I had a disease that I didn't want to talk about. And you mentioned contagious. When I was first diagnosed as lupus, that was the big joke, is that whatever it is, no one's ever heard of it, so it's got to be contagious. But it wasn't. Trying to explain to somebody what you have or why you don't feel good is very difficult. So in most cases, you just don't talk about it.
You mentioned earlier that you're frequently tired. Does that mean that you have to rest more than most people?
You should. The afternoons are always bad for me. There's 90% of the time you start your day off pretty well, and by afternoon you're just dragging. And then the 10% of the time when you don't feel like that, it's amazing that people feel well every day. You're so used to it. I'm used to it that the few days that I do not experience that, I can't believe that someone can feel that well.
So on the average, would you say that you're able to continue with your work in your life for 6 hours a day without feeling debilitated?
Basically, yes. And there's times when you push too hard, you usually have a few days warning, and then if you don't slow down, you do end up flat on your back for 2 or 3 days. Can usually knock it out for me. Other people will be down for weeks.
Mm-hmm.
That really makes it difficult for your career, doesn't it?
It does. It does.
And it would be hard
in a way.
Your employer would have to be very understanding.
Yes, very much so.
Kathy, may I ask Mary a question relative to what you just said? Mary, when you were taking medications such as Plaquenil, aspirin, and so forth, did that, I know that it improved your skin manifestation. Did it improve your fatigue?
It definitely improved my fatigue. The only thing it did not affect was the fevers.
Mm-hmm.
But it definitely affected the overall way that I felt. when I was on medication.
Has your family been understanding and supportive?
They have been very understanding and supportive. It took them a couple years to discover what the disease was also, because it was so confusing. And when I was diagnosed, nobody basically had ever heard of the word, including ourselves. I mean, it was just a word that you never heard, a disease you never heard about. And then to try to find out what it was confusing.
Do you feel that now doctors are more familiar with the disease?
Yes, I think that's true. We knew about lupus, I've known about lupus for a long time, but there was no really satisfactory treatment prior to 30 or 35 years ago. And since then, with the discovery that some of the antimalarials, particularly Plaquenil, and in severe manifestations, the cortisone derivatives have been helpful. More doctors are becoming familiar with lupus. More time is devoted in medical school to teaching about lupus, so that an alert physician who will take the time to listen to the patient and do laboratory studies and so forth should be able to make the diagnosis of lupus in most instances. It is unfortunate that some patients are not diagnosed and told that they have arthritis, or that their fatigue and so forth is emotionally based, and actually there are other central nervous system manifestations such as depression, even convulsions, that are sometimes initial manifestations of lupus. And unless the doctor thinks carefully and takes the time to do a complete workup in such a patient, the diagnosis may be missed. I know I'm being verbose, but yes, the doctors know more about lupus, and more can be done about lupus today than in past generations.
I think it's only fair to mention, Mary, because I would like other persons who have these feelings and these doubts, that you had to go to several doctors before they were able to correctly diagnose your illness.
The many doctors prior to make a long story short, when they said finally diagnosed it as rheumatoid arthritis, sent me. My parents lived in Los Angeles, so they decided that I should go to a physician there who was a very well-known internist, who put me in the hospital for 7 days and ran every test possible. With each day that I lay there, I got better, because rest helps the disease. They never once tested me for lupus. So I came back here and suffered with it for about another year and a half before I started with the skin problem. I woke up one day and thought I had hives, and it was also painful. So I went to one doctor who said he'd never seen anything like it, who sent me to another doctor who told me I was vain. And
vain because you
yes,
had a rash?
That was my biggest problem, is that it was nerves, and that I was young and I was worried about my appearance. And a week later I went back to him because it went from my hands and my arms to my face. And he again said this. Now he knows that's the problem because it's on my face, and now I'm really upset about it. And it was nerves, and if I didn't calm down, then the spots wouldn't go away. Then I got very ill and was treated for some time by an internist, and then the skin problem got worse, and he said, I've never seen anything like it. And then I ended up with Dr. Falk. Been there ever since.
Dr. Falk, there is a factor here I would like to ask you about. If a person has lupus and they are nervous, unhappy, does this affect them adversely? Does it make their illness worse? Does it make their bones ache more? If they have an emotional problem.
Yes. I think this is not only true of lupus, but it is true of chronic illnesses generally. If the person is fortunate enough to be a little more philosophical about his fate than others.
Oh, that is so hard to do.
It's very hard to, very hard to do. There are some people who take it very badly, and in doing so fail to cooperate with their doctors, and they think the condition is hopeless, when it really is not hopeless, because it is no longer considered a fatal disease. I don't mean that people don't die of lupus, but many of them who do are those who have been neglected or who have neglected themselves. When you're depressed about something, it's always worse. And I don't think that's just true of lupus, but lupus is certainly included among the diseases. It's true of diabetes. Some patients do very well if their diabetes is controlled and they follow their physician's advice. Other patients just don't have the ability or the desire to follow it, and their diabetes does very badly, and they have many complications of diabetes. I'm sorry to bring something else in, but I think the two are analogous in that respect.
You mentioned that some persons do die as a direct result of lupus.
Yes, in some individuals, lupus can go on to what we call lupus crisis, and particularly if it affects the kidneys may become completely inactive, destroy the tissues of the kidney so that they have to have dialysis, and in some cases kidney transplants. The heart can be affected severely. Pneumonia sometimes sets in, so forth. So that there are a number of people each year who die of lupus, either because their lupus is so severe or, in many instances, because they have not adhered to the prescribed regimen.
Now, Dr. Falk, you were kind enough to bring some slides with you, and I would like you to describe to our viewers the patient and how it affected them, if you would, please.
This is lupus is divided into two main forms. There are many subsets of lupus, many subsets, and new ones are being described all the time. Patients who have slight variations of the disease. But the two main forms are the cutaneous lupus and systemic lupus. This is an individual, I'm sorry that the slide does not show up better, but that's the way it is, who has a cutaneous form of lupus. Now, it's often heard that cutaneous lupus is mild. It's mild in the sense that if it is just cutaneous, the other organs aren't involved and the patient doesn't feel as ill. However, the skin lesions can result in scarring, permanent scarring, if they are neglected. And this is a manifestation of that. Here is another not too good slide of an individual who has the lupus. The borders are the active portions of the lupus, the advancing lupus. The central portion shows scarring. It looks like that patient, to me here, has white paint on its face, but those are scales. This is a characteristic appearance of a patient with systemic lupus. There is the so-called butterfly rash. By that we mean the involvement of the cheeks and the nose in a butterfly sort of configuration. This is a patient with acute systemic lupus who is quite ill and also has the rash in the butterfly distribution, as well as, if you notice, the neck is involved too. This patient has a high fever, is very ill, has inflammation of the eyelids and so forth. Lupus does not occur frequently in infants and children, but it has been described. This is a newborn baby who does not really have lupus, but has absorbed or has had some of the antibodies of lupus, the production of the abnormal immune system transferred through the placenta, and shows signs of lupus, and in almost 100% of the cases, these babies will clear up and do not actually have lupus. Although lupus has been described to occur in individuals as young as 2 years of age, but it is infrequent. This is a portion of the face of a patient with cutaneous lupus, with scaling and atrophy of the skin and some scarring. This again is a patient with lupus over the butterfly area and about the mouth. Now, I wanted to show you the mild form of lupus. If you notice, this patient has this man is of Latin descent, and he has a dark round spot in the center of his face, which doesn't look too serious or too severe, but it is a manifestation, a lesion of cutaneous lupus. Lupus does not always, lupus of the skin, cutaneous lupus does not always affect just the face. It can affect other organs of the body, or other regions of the body, I should say. And here is an individual who has lesions on the feet. Here are lesions on the backs of the hands, possibly precipitated by sun exposure. Many patients with lupus do not tolerate sun exposure, ultraviolet light, well. And skin lesions are sometimes brought out due to the effect of the ultraviolet light on the nuclei of skin cells, with the resulting immune complexes and toxic factors which cause lesions. And here is such a patient. This is a scalp with scarring. I know that it doesn't, it's hard to tell that, but this is a scalp with scarring. These are lesions of discoid lupus, not systemic lupus, in which with healing there is scarring of the scalp and loss of hair. The scarring is so deep that the hair follicles are destroyed, the hair roots are destroyed, and the patient has result in permanent scars. I have this picture because when people see pictures of other individuals with skin rashes, they immediately think everything is lupus. Here is a young man who has acne rosacea. This is not lupus at all. It is an eruption on the butterfly area, but it isn't lupus. It's acne rosacea, and it has no relationship to lupus whatsoever.
Dr. Falk, I'm glad you mentioned that, because since we're talking about rashes and this type of thing, you are so accurate in saying that everyone that has a rash will immediately begin to think that they have lupus.
Yes.
Are there any specific hints that you could tell people that it is a lupus type of rash?
The most common type of lupus rash is one in which there are scales over a red patch, scales which you can either pick off, or which are like plugs, like carpet tack plugs in the pores of the skin. It sometimes itches, but itching is not necessarily the main symptom. These lesions or patches tend to enlarge and then appear elsewhere on the skin. A patient with blisters and red weeping rashes which come on suddenly and are very, very uncomfortable and itch intensely usually don't have lupus. I just as I say that, such a person can appear, but usually not. Usually it's a type of an allergic or irritative dermatitis, and there are thousands and thousands of skin diseases, and lupus is only one of them.
Mary, we don't have much time left, and I wanted you to tell our viewers about the Northern Nevada chapter of the Lupus Foundation.
Okay.
Are you a member?
Yes.
And
yes.
What do they do for people?
Basically, they formed the organization in October of 1980, and the purpose of it is to give support and a place for people, number one, with the disease, so that they can go get information, pamphlets, booklets, talk to other people that have the disease, and basically support each other And in the next breath, the reason for the organization is so that the public, the general public, becomes aware of what the disease is, that there are a lot of people that have the disease, trying to raise funds for research, and basically just to try to educate people, especially people that have the disease, because a lot of people that have the disease, they don't know where to go to get the information that would save them a lot of hours and days of wondering what it really is that they have. Because if you read a medical explanation of it, it's very confusing to a layperson.
I'd also like to mention that the lupus chapter locally has a booklet that they will be glad to send to you if you call them on the phone, and this really does give a very thorough explanation of lupus. Dr. Falk, research on lupus, is there hope?
Yes, there is hope. There is a great deal of research on lupus. The National Institute of Health in Washington has been studying lupus and related diseases for many years, and that they continue to be funded in these hard times. They will continue to work, and they have made great strides, particularly in the treatment. The cause of lupus is still not completely understood, but the treatment has been improved a great deal. And a patient with lupus in proper hands and adhering to the prescribed regimen will usually do very, very well and lead an almost normal life. I think it is very important to say that many patients with lupus are sensitive to sunlight. I may have mentioned this before, but I'm not sure. And that they should certainly not sunbathe, and that they should habitually use sunscreens with a high sun protective factor of 15. And I would say that summer and winter...
Dr. Falk, I'm sorry.
Yeah.
Our time is up. Mary, Dr. Falk,
you.
thank you very much for coming.
Thank you.
And Mary, good luck to you.
Oh, thank you.
You're a brave lady. My guests have been Mary Lemaris, who is a lupus patient, and Dr. M.S. Falk, a dermatologist. This is Kathy Millanet, and until we meet again next week, goodbye.
The Toyota Cressida wagon comes with a lot of standard features.
Oh, what a feeling!
The Subaru GL wagon has many of the same standard features, plus a digital dash and sunroof. The Toyota is about $14,000.
Oh, what a feeling!
And the Subaru, about $9,100, almost $5,000 less.
Oh, what a feeling!
See your Reno, Carson City, and South Lake Tahoe Subaru dealer today.
And finally, as we've been saying all night, this hopeful last gasp of winter won't last forever, so you'll have the chance to get ready for the sun. Now, despite the warnings that all that sun is bad for the skin, we all still go out and bake ourselves. Andy Culpepper has some hints on how to lessen the dermis damage while getting a tan.
If you want to protect your skin from damaging rays, you need to pick a product with a sunscreen. Most of the containers are labeled with sunscreen information, but if you have any doubts, look in the ingredients for the word PABA. Sunscreen products vary in strength from a minimum protection of 2 to a maximum protection of 15.
Now, a lot of us sun worshippers think that to get that deep, dark, fast tan, you have to go with a 2. That's not true. Most dermatologists prefer that you go with the ultimate protection of a 15. You'll still get the dark tan. It'll just take a little more time.
Dr. Mortimer Falk recommends using a sunscreen in the morning on a regular basis, just as you would an aftershave or makeup base. But if you should find yourself with a nasty burn, he suggests applying a damp cloth, a simple cooling cream, or, if necessary, an over-the-counter hydrocortisone cream. For severe burns, see your doctor.
If there are blisters, if it's painful, and you can't sleep, I think it's a good idea to go to the doctor, because the doctor can give you internal medication or injections if necessary to take the fire out, to take the inflammation out, and even prevent scarring if the sunburn is deep enough.
So remember, if you want to keep from damaging your skin, stick with the sunscreen. And don't forget to pick up something for your lips, too. Andy Culpepper, News Center 2.
I'm certainly ready for some sun.
Oh, you bet.
Well, a reminder on the main edition tomorrow, the story of a new petition for a constitutional amendment on taxes here in the Silver